So, as you can tell, I personally am a little giddy to be able to get together with people. I expect next year, Melissa, if we get invited back, we'll have 1,000 people here. And I'm appreciative for you guys coming out. I'm appreciative for everyone's passion around what we're all trying to be better with. Thank you, Melissa and team, for doing what you do. It really, I know what's coming next, and really the patient is what's most important to me. So I'm going to start crying in advance of bringing somebody up on this stage. But I think I want to talk to you first about the clicker. About how, as a tech team at Annexus Health, we slice up the problem. So we see that there's a lack of understanding of an optimal workflow, of tools and people to do the job to make sure that the support, the resources, the services are delivered to patients. And not just that we go and find a service, that it's fulfilled, that it's delivered, that the provider organization and the patient gets the opportunity to benefit from that service. And if you think about it, and I know the complex disease states that we operate in, so right now, we grew up in oncology. So we've been serving cancer patients for years now. We're stepping into other disease states. Those disease states, right now, we just stepped into retina and vision. We're going into rheumatology, GI, neurology, hemophilia, HIV. So these complex disease states, historically, the provider organization has been responsible for managing what's available, right? But the problem is they don't have the tools, resources, right? The real clear understanding of how this all needs to be done. And so we run into this challenge of, okay, there are resources available, but are we maximizing them? And then I think that creates a spiral, right? So if we're not using what's available, then we're not going to get more. So we clearly believe as an organization, if we can provide solutions that improve how services are found, how they're fulfilled and delivered, we're going to get more resources. We're going to get more money. And it's something that we're really passionate about doing and providing. So we think by providing an ecosystem that allows for this all to be managed, start to finish, whether it be copay, reimbursement services, free drug, travel and lodging, benefit verifications, prior authorizations, right? That's all part of the access journey. If provider organizations that have skin in the game have tools, resources, one central comprehensive location to do everything and manage every component of what they need to make sure patients get on therapy, we're going to be better at it. So we're going to talk to you a little bit more about our ecosystem and our approach, but what we wanted to, well, I guess I started, but really start this with is what matters most to us, and that's the patient. And that's what we are doing this for. That's why I wake up every morning and, to be honest with you, bust my ass, but I love it, right? For the patient. So we have a really cool story, if you don't mind me sharing.
Cancer takes its own toll on you. And when you bring in the financial impact of it, it's really devastating to your soul. Even though I had found it like maybe 2 months prior to us going, it was still stage 3. I kind of went numb. It was an 18-month journey that was extremely difficult. Yeah, I carried a lot of guilt for impacting our lives the way I did. Collectors calling on a daily basis wanting their money, and I'm like, I'm just trying to survive, you know? I feel like they all need some type of financial navigator within the oncology offices or within the breast specialist offices that has an initial conversation with you, like that this is going to have a financial impact on you. You know, it's going to be maybe devastating. But preparing somebody for that is so much better than you feeling alone out there. You know, for me, it was the complete guilt of financially ruining my family. Nobody needs that guilt on them. We didn't have to go bankrupt. I know that now. I didn't know that then. And I don't want anybody else to go through it. I just want to help people. It's been a journey for me, and I don't want their journey to be as many years as it's been for me.
You wanna come up with me? We don't have a sticker that says I hug, but I hug. All right, well, the way Beth communicates, and when she did this for us, and how I've seen her communicate since, it's really a surprise to me. But Beth is nervous, and you can't tell, and she was really anxious over it. So can you guys give her another really warm welcome, make her feel comfortable? I told her that we all want to hear her story. You guys want to hear a little bit more about her story?
Yeah, it's, you know, the reason I'm here, of course, is mostly because of the financial aspect of it. But of course, you know, cancer plays a much bigger toll on you than just the financial piece. Financially, I think where I'm so sad and maybe frustrated in my journey is that we didn't have to go bankrupt. You know, I know that now, but we didn't have, either in the breast cancer office or in the oncology office, anybody talking to us. We didn't have an advocate. We didn't have a patient financial advisor. We didn't have a social worker that had a conversation with us about how impactful this was going to be on us. And I'm grateful for all of you today that you're here, that you're in those spaces, and you're making a difference. Because it was a journey I don't wish on anyone, and financially it was soul-sucking. Sorry, you know, it was difficult.
When we were talking this morning, we talked about what we were going to share. So you can just stop sharing, but there was a significant impact, not just financially, but on your family as well, right?
There was. You know, my family, there was a lot that they had to pick up with us, you know, and I don't come from a family with a lot of wealth, but they all had to pitch in and help in any way they could, and they were there for me and got me on the other side of it. And as I shared in the video, I have a lot of guilt, and I don't like that. But it's where I am. I'm getting through it every day. I'm getting stronger with it, but it hurts. I think it impacted my marriage. I'm divorced now. Yeah, it's just.
Thank you. Thanks for sharing. And this is why we all do what we do, right? So we don't have to get to this point. There were so many things that could have been done differently with Beth's journey, and that's why we're here to change the game. We'll talk a little bit more about that, but I do want to talk about something that you're doing and what you've done in your life that is beyond Annexus Health. It's totally separate from anything that we do, and learning, what you're focused on and what you're trying to build is super intriguing and powerful for me. Do you want to share a little bit about how you see your role in others' lives associated with maybe some of the things that they went through or don't have to go through in their post-treatment?
Yeah, so 7 years prior to my breast cancer, I actually had a brain tumor that was removed and took my hearing and left me with facial paralysis. Then 7 years later, I went through the breast cancer. And through all that, I just, there was no one, once the door was shut on treatment, I didn't really kind of know what to do with myself. Your friends kind of stopped calling, the meals stopped coming in, and you're kind of left in this space of unknown. You have a lot of anxiety about reoccurrence, et cetera, and I just felt that there was a need for people to be in that space, coaches, therapists, whatever, to be in that space. And so I've been on this journey. I got certified as a coach, and I want to help other people. Once that door does close, with all of you, that journey is not at all over. There's so much mind, body, and soul. Cancer changes you completely. You think about things so much differently. And I want to be that person because I've been there. I want to be that person to help other people thrive beyond their cancer, beyond that journey. That's what I'm doing every day. I'm thriving. I'm very grateful to be here. I know my things could be differently for me, but they aren't. And I feel like through all of that, my purpose and passion is to just help others on the other side of it. And so I'm working on, I've helped several people, and I want this to be my career. I would love for that to happen, is that all I do is coach and help people outside treatment thrive and just, get into a better space, mind, body, soul.
Super intriguing to me. Melissa, I'm sure it is to you as well, right? Because our mission is very much live, right? Aligned, making sure that we're doing everything in our power as advocates to ensure patients get the intended therapy, so that they get the intended outcome, so that they have the benefit of what our providers, right? If we trust our providers to make decisions for us, what they design and what we're able to follow through on. But after treatment, I know running a company, my head is down on focusing on what can we do to improve how patients get care. How is their care journey managed? But I don't think often enough about post-treatment. And I think a lot of provider organizations that we work with, it's the same way, right? They're just fighting the battle every day to get paid. They're fighting the battle every day to see patients. So one of the things I would ask you guys is spread the word about Beth. If you want to get to know her, you share what information you're willing to share. But I really do think not only does she have a passion, but I love her approach to really coach and help people with what they have next. And you made me cry this morning. I'm so proud of myself for holding this together, right? Where when you were telling your story and you said you don't like the word survivor. So we can, whatever, all words mean different things to different people. So if you like the word survivor, you keep using that. But Beth shared with me, she wants to teach people to be thrivers, right? I don't know that we focused on that like we should. So Beth is here to plant seeds. So if you guys know of provider organizations that would be willing to work with someone like Beth, to make a recommendation on behalf of a patient, to make contact, and it's just, even if they take one thing away, right, that improves their approach. And I just think about the many family members that I've been associated with or friends. I'm dealing with a really good friend of mine that got diagnosed with advanced colorectal cancer. And what he's dealing with mentally right now is much more significant than what he's dealing with physically. And I think that post-treatment, we really need to think about those things. And whether it's Beth or someone else as advocates, I think that's something else that we can encourage our health system and us as advocates to really find solutions there as well. So thank you so much. What's the best way? Should we just make sure maybe we have Namapa send out your information if folks want to contact you?
I can give her a couple cards. Yeah, I have with me.
Great.
Thank you.
So I don't know how I bridge to what we want to talk about organizationally, and we're going to come back, Beth, to you and I, but I'm going to try. So you guys know, right? This story isn't unique as it relates to the powerful impact that her journey leading up to and inclusive of treatment caused Beth. We see this over and over again, and it's why we're in the room, right? It's why we're viewing online. So as an organization, we actually formed Annexus Health in 2017, but we started building the software back in 2014. So this has been a really, really long journey. I can't believe it when I think about it. And so we went at risk to build a comprehensive destination for provider organizations to manage all aspects of financial assistance. And then we began sliding into other areas associated with access services. And the way we looked at what was the opportunity, and I think what clearly sets us apart from others in this space, is our approach to creating this comprehensive way of managing patients, all aspects of the workflow, right? Just getting an application out the door, just getting a ward is only a small part of the problem. So we invest a lot of money in data science and analytics. And when we started to look at our data coming back on the awards that were provided, whether it be the commercial copays that are available through manufacturers, the charitable foundation copay assistance that's available, there was so much that wasn't utilized. And there's good reasons sometimes, right? Where patient goes on they stop therapy, they move on to therapy. But we found through our analytics that there were a large percentage of funding wasn't utilized because there isn't a good process. There isn't a good tool to make sure you're managing that payer, right? These awards are payers. They've got, these provider organizations have their rev cycle. They have their pharmacy dispensing software to manage these things in the traditional payer world. They don't have that as it relates to financial assistance. A really important revenue line item for them, but most importantly, a really, really important resource for patients. So it's like, I say it all the time, it's like a Nexus Health starting a business. And one of our investors, writes us this big check, and we sit it in a bank account, and we start to build a business, and we don't use that money, right? And that's what's going on. So really creating this comprehensive destination was a big lift for us. I was telling Beth this morning that, so I've had my mother, father, some very close friends go through experiences similar to Beth. I, thank God, have not dealt with cancer, but I've dealt with financial hardship through this journey. When we started building this, it was at risk. We weren't getting funding. I poured everything into it. We almost closed the door. I ran out of current assets time after time after time. I love the faces I'm staring at because hopefully you're as passionate as I am. I wanted to put it on the line, right? And we put it on the line. I think we created an MVP. Right? We created a minimum viable product to get providers to start using what we were offering in terms of tools and solutions. And I thank God for them, right? Those early organizations that committed to us, right? And utilized our tools and services so that we could continue to invest and make them better. So that's a big one, really creating something that's sticky enough and useful enough. And then as we progressed, one of the next things that were really, really important and central to what we do, it's connectivity. So if we're going to use technology to improve how things are managed, we absolutely have to connect to systems, right? So we've got to be able to connect. If we're this ecosystem that's going to manage access services provider organizations on behalf of patients, we have to make sure that we're connecting to the systems that reside at the practice, the rev cycle, the EHR, the pharmacy dispensing. But the really super cool stuff that we're doing with pharma and life science in general and charitable foundations is connecting API wires. So we're sharing information that gives us the ability to push buttons, right? Application filled out. I already said that's an easy one, right? There's a lot that can do that. But there isn't anybody else that can push that button again and say, yep, you got approved. Yep, you got approved for $25,000. Yep, you used it, and now there's $24,000 left on it. Those are the things that we can do because we're connected, right? We're digesting claims and payments from the rev cycle. We're ingesting pharmacy data. We're pulling orders in from the EHR so that we have an end. One thing that I'm super passionate about as it relates to this overall passion is let's stop being reactive. Let's be proactive. Every single patient that walks in the door of a provider organization should have the benefit of a conversation. Resources, right? Resources, sometimes it's hard to manage that. The resource that we provide to allow them to ultimately know who they should be working up is really, I think, a huge benefit that we provide. And then I think the cycle management thing I mentioned in the comprehensive approach to what we do. So I went into a lot more detail, which will make it easier for me to go through the remainder of the slides. But just diving in to the plight of the provider. So we find that one of the challenges to utilizing our software is the administrative stack and burden that they already have to try to do something like our technology. So we're solving for the administrative challenges, the financial challenges that the practices have, right? To try to, especially in these complex disease states where they need to be the quarterback for access services. So they're bogged down. And even though we have a path to make them more organized, it's work, right? It's work for change. It's work to make sure that you're doing everything thoroughly and completely. Because until we connect with every single charitable foundation, every single life science provider, there's still a manual component to what we do, and it produces wonderful analytics. It gives provider organizations the ability to really understand where they stand as a practice, where they stand from a patient's perspective, to make sure whatever's available is optimized on behalf of the patients. So we're battling through this administrative burden, and we're cleaning things up and allowing provider organizations to be cleaner and more sophisticated around what they do associated with managing access services and financial assistance. I had a slide pop up that I didn't anticipate, so. I think you heard enough about this. You guys hear me? Yep. The one thing that I would add to that is running a business is tough. Running a startup is even tougher, right? I can tell you that my co-founder, Brad Frazier, hopefully he gets a chance to see it and knows that I mentioned his name. When we have to make tough decisions, and we make them on a regular basis, we'll get in a room together or we'll get on Zoom together, and the first question we ask ourselves, what's best for the patient? There hasn't been a decision that we've had to make as co-founders that hasn't been so much easier than I ever anticipated going into those kind of conversations. No matter how aligned you think you are as business partners, there's inherently things you're gonna look at differently, right? And approaching things from different backgrounds, diverse experiences is really important, but sometimes that causes challenges. It's much easier to get through those with the focus on patients. So one of the things that I think is really cool about my team is the way we think about this space. So my gray beard will tell you that I've been around for a while. I spent a lot of time in pharma. I did a lot of different things. And so if I've been in the industry over 30 years, going way back, it's been the same, right? Everything that's available is product or manufacturer driven as it relates to solutions for provider organizations. So one of the things I hope my team isn't tired of hearing from me is that we're here to generationally disrupt how access services are managed. So we absolutely say, we're gonna provide you everything. We're managing content for, just in oncology, over 2,000 assistance options. So we're using RPA, we're using bots, we're using manual auditing procedures so that we can let the market know what's happening within 3 minutes. 3 minutes, right? That hasn't happened, right? We're the first to be able to do that. And it's because we know that this is so valuable to know what's available for a patient based on their specific needs, their insurance, the drug they're on, the diagnosis that they have. So coming at it from a provider-centric approach in these disease states where they're responsible for managing these patients in the access journey has been a game changer for us and how we make decisions. The experience of our team is really important. And I say that, I think, partially because I'm super competitive and there are competitors in this space, and I think that is one thing that separates us is our knowledge base, our experience base on the med tech side, from the physician network side, from the services angle and how they've been delivered or not delivered over the years. But also, I mentioned earlier, folks were willing to take a chance on us from a provider organization perspective. I've been part of incredible technology offerings, right? That I think were the most badass idea I'd ever seen, and it never worked. And it was because they didn't have someone willing or enough people willing to take a chance on them. So I think the network that we've established, our leadership team over the years, has given us the ability to have trust. And that puts additional pressure on us to pull through and make everything we do better. So the experience of our leadership team and our company in general, I think, clearly sets us apart. So getting back to some of the tactical things that we do, those that are exposed to this know that if you want to get assistance for a patient, if it's copay, it's probably one of the easier forms. If it's free drug, holy crap, right? How much time do you have? Grab a cup of coffee and a beer, right? It's not easy to just apply for something. But then when you apply for something and you hear back that it's approved, where's that being stored, right? It's crazy over and over again when we go from one provider organization to the next, the tools that have been available in the generation that we're living in, right? The most sophisticated are using spreadsheets. Others are using Post-it notes. Others, and probably those same two groups, are using free text notes in the rev cycle, in the EHR. If it's not organized, if you're not operationally sound, it's not going to work. So this fragmented approach is a really massive problem as it relates to us getting what's available to the patient, right? So we're definitely solving for that. I talked about connectivity and how important that is for us. From the cycle management perspective, I'm not going to say much more, but I'm just going to pause and ask you to think about whatever, if there's an example in your life that you think you're really good at operationally, if you're a really good spreadsheet person, if you're a really good project manager, if you don't have Excel, or if you don't have QuickBooks, or if you don't have an EHR, you can be the most organized person in the world, but there's going to be gaps, right, in the entire process of things. And managing access services and financial assistance is definitely a process. And managing things in small components and not the rest of it creates gaps. So what do we offer? First, I want to not mess up my mic. I better sit still, right? We played a little game at dinner last night, and I should have used this one, about what was it, Lori? What you're most proud of, or what was the coolest thing that happened to you in the past year? So I gave a personal one. I'm a father of 3. I have 2 adult children. I can't believe it. One got married during COVID. Then they chose to celebrate it, right? Because they got married in a small ceremony with the immediate family. And then we got together to celebrate, and I was wondering, how would that happen, right? How's it gonna happen? And it was the most wonderful sharing opportunity. There's some things that are core to me and my family, and faith is one of them, and being able to share that with others was just so cool. But I can tell you what's right up there professionally, well, maybe not, I mean, it's really good professionally, is what we're producing in the way of data science, right? Because I'm telling you about, like, let's impact outcomes. Let's make sure that providers have the tools, right, to be able to do what they need to do. And before I tell you the next thing, one of our missions, and we're a firm believer this is gonna work, right? If we prove that access services done better are improving patients getting on therapy quicker, and staying on therapy, I guarantee you we'll get more money. What did I promise you, Melissa, back there about what you're doing, right? There's money. If you can impact patients getting on therapy, there's money, and I want to help, right? We're applying data science. Our work is doing those 3 things. And when we started to produce that this year, all of this stuff in our head, and we're putting down on paper, and we're putting it in computers, it's with the vision to impact care this way. We're meaningfully impacting care, and we're measuring it, and we're investing a lot in measuring that. So as an organization, Assist Point is our technology. That is the offering that provides the ability to manage in its entirety the cycle of financial assistance. We're expanding rapidly into other areas of access services. So our services division at Paro provides more than our technology does. We do BVs, we do PAs, we manage more holistically around access services. There's components of our technology that help with at least getting some of those services, but we do a bang-up job of making sure that the entire cycle of financial assistance is being managed. As an organization, our tech, we're committed to expanding this platform into other administrative areas. We're gonna provide an offering that creates a work listing environment, a tasking environment for providers to manage that entire patient journey. So when we think about the things that are really tough in the cancer space, patients that are on oral therapeutics and the remote nature of managing them, the cell and gene space, it's crazy as it relates to the administrative logistics to get people on therapy, make sure they get the therapy that is intended for them. That's what we're doing with our technology. Within our technology, we measure everything that we do. We're consuming a ton of data, so we can tell real time, the provider organization, you're doing really well. You need to improve in this area. We talked about a few of those last night, right, Ann? Right? There's a couple areas that we can improve upon, and ultimately, you need the data to do that. And I mentioned at Paro, and at Paro, we launched the beginning of this year, not just because I'm a capitalist, but because it was a blocker to the uptake of our technology, right? We run into many provider organizations that don't have enough staff, they don't have the qualified staff, they can't keep the qualified staff, so we weren't going to let that be a blocker, and we will do it. And we will build out the most incredible SOPs, we'll optimize workflow, we'll teach you how to use the provider organizations, how to use our software, and they're gonna pay for it. But if they want to take it back over and do it again, our commitment is, give us 6 months. We're gonna get you to a place, if you feel like you can staff it, you take it over. So we're truly we launched at Paro to enable our tech to be utilized to really improve how the patient's care journey is managed. So that's what we're providing as an organization. what we're providing as an organization has given us the ability to impact patients significantly because we're working with some of the largest cancer providers in the space. And I mention that and I'm not dropping names, but I mention it because they feel really good about what we're doing. They feel like we're improving the game for them and their patients. So if you want to learn more, if you want to spread the word, if you want more details, this is how to reach us. We love to take people for a test drive and demo what is really our technology, not vaporware. And we love to show you our product roadmap and where we're going to really improve how the patient's care journey is managed by reducing the administrative toxicities, right? So everybody's heard about financial toxicities. We're in the game to reduce that, but we're in the game to reduce administrative toxicities as well. So I'm going to try not to cry and say thank you. Is there anything else, not to put you on the spot, that you want to share with the group?
I want to thank you. I want to thank Annexus for taking this beast on. I mean, to me, it's a beast because I didn't have it. And for you guys to put something together and put it out there to help people manage through cancer in such a different way than I did. I'm very grateful. So, just thank you.
Thanks so much, and thanks for sharing. Can we give Beth another applause for what she's doing? I want to thank you guys too, if you can hear me. Thanks for being willing to, no? We're not, what are we doing? Oh, okay. Thanks for doing what you do, Namapa. Thanks for creating this opportunity. It's not easy, right? What's the next variant? So we're Delta. It's not United Airlines, right? It's Moo or whatever. So just powering through all of this and being here in person. Thanks for those that are watching online and committing to really changing the game for patients. I'm glad I'm doing it with you, even though I don't know you guys. Thanks.